thank you for having me. It's an exciting opportunity to come up here. I end up sometimes getting a lot of phone calls from people up in the northeastern region because they, have trouble finding a vet that works with pigs, and so I do handle, a decent amount of phone calls here and there from people up this way. So I'm excited for the opportunity to speak with you guys today. And I'd like to keep it really very informal, especially with a group this size. I mean, let's ask questions, interrupt me during this, and ask questions if there's something we don't understand or you need me to explain further. I'm happy to kind of answer all your questions. So looking forward to the discussion today. So just as a little bit of a background, so yes, I'm part of 4-Star Veterinary Service. Well, we've just changed our name. So now we are now Integrated Veterinary Network. And so that is because we have a joint venture of 4-Star Veterinary Service, which has been a 6 vet office practice. We've joined forces with Carthage Veterinary Service, which is a practice out of Illinois. So all together, we cover essentially the Eastern Corn Belt and the Midwest region. We now have 8 offices and 29 veterinarians among all of those offices. So our office is in Pennsylvania. We also have an office in Ohio, 3 in Indiana, Illinois, Michigan, and North Carolina. So we cover a lot of area, a lot of pigs. We definitely operate very independently of each other. We kind of combine resources for certain aspects of the business, but we have made a decision to kind of come together for a lot of different reasons, mostly to provide better service to our clients. So that's a little bit about who we are. So if I say 4-Star, I really should be saying IVN or Integrated Veterinary Network. But a little bit about the office that I work in. We're based in Elizabethtown, Pennsylvania, which is in Lancaster County, so Amish country, Pennsylvania. We have 3 veterinarians at our practice: Dr. Michael Pearden, who's the owner of the practice, Dr. John Van Blarcom, and myself. Like Alicia said, we do pigs. That's what we do. So Dr. John dabbles a little bit in some poultry work here and there, and I might give the rabies shot to the dog or something like that. But other than that, we're doing pigs. That's what we do. That's our bread and butter. So our office covers about 50,000. Actually, probably if we really counted, it might be up to 60,000 sows that we cover in our office. Primarily work in PA. I'm also licensed to practice in New York, Maryland, Ohio, Virginia, West Virginia, Delaware, North Carolina. I'm not practiced there. I'm not licensed in Iowa, but the other vets are. So cover a lot of ground just in our region. We service primarily independent producers. So most of our work is commercial producers. That's a vast majority of what we're spending a lot of our time on. We also, in our area, get a lot into the niche market and those herds. I also deal with backyard pigs. And pet pigs, potbelly pigs. So I really love that part of the job. I love that I could be in a 1,800 head sow farm one day and then be trimming hooves on a potbelly pig the next. So I really enjoy that diversity and love that part of my job and enjoy those challenges. So we see a lot of different kinds of pigs in Pennsylvania. Just about myself, I should say that quickly. Again, my name is Carroll. I grew up in PA, did not grow up on a farm. I mean, grew up in a rural area, but in the suburbs, so I didn't have an ag experience at all. I went down to North Carolina for undergrad. I worked at a small animal clinic for many years as a technician, actually. And during an internship with my now boss, fell in love with pigs. So I didn't really even touch a pig until I was in my 20s, probably. I just fell in love with the business. I completed veterinary school at North Carolina State University. So there's a lot of pigs down there. If you don't know, North Carolina is number 2, right behind Iowa as far as pig production goes. So I got to see a lot of pigs down there in North Carolina. So that was a really good experience for me. So after graduation, made my way back up to Pennsylvania to practice in that now. So as far as discussions today, these are the topics that we're going to go over. I'm going to discuss VFDs and a VCPR, so the veterinary client-patient relationship. Also hit some main diseases in the swine industry and talks about some vaccination programs. Also talk about parasites and control programs for those. Breeding, different techniques and management for breeding, and also how to manage fairlings. And hopefully anything else you guys maybe want to talk about, we can hopefully have time to discuss those as well. So let's jump into VFDs and VCPR. So this is probably one of my more lengthy presentations, but I'd like to get this done with first so we can really talk about the pigs later. But this stuff's important. It's very important because it affects how we are raising our pigs, and it affects the ways that you guys can get medication. So certainly important to discuss here this morning.
Laura, could you go back?
Sure. Here?
Yes.
Okay, sure.
Thank you.
Oh, sure, no problem. Okay, so hopefully most of you are aware, starting January 1st, 2017, the use of medically important feed and water medications began to require more veterinary oversight. So we're going to discuss where these rules came from, what they mean, and how that impacts swine producers. I always like to say this when I'm talking about VFDs or veterinary feed directives. Veterinarians did not make these rules. The FDA did, the government did, so we just have to enforce those. I would like to keep my veterinary license and continue to practice medicine, so I will continue to follow these rules as set out by the FDA. So I always tell my clients, don't get upset at me, get upset at your government. So what is the government trying to achieve with these changes in regulations? Well, there's been, development. You've probably seen the news of drug-resistant diseases in the human health field, and so we don't know necessarily all the reasons that some of these bugs had developed, but we do know that it's related to probably overuse or misuse of antibiotics, whether that be in the veterinary field or the human medical field. So the government is really trying to preserve the efficacy of antibiotics used for humans and for animals. We're trying to prevent the development of superbugs and just reduce the overall use of antibiotics within the agricultural industry. The government at this point in time is not looking to eliminate antibiotic use in animals. What they are trying to do is reduce overall use. So we can still use antibiotics to treat disease, to control disease, to prevent disease, but we can no longer use them for growth promotion claims. The responsible use of antibiotics, this has come up a lot, within the pork industry. The National Pork Board has set some guidelines for that. I've taken this directly from the Pork Board website. So, use veterinary input as the basis for antibiotic decision making, using antibiotics only when there is an appropriate diagnosis or history, limit antibiotic use to ill or at-risk animals, treating the fewest animals as indicated. Antibiotics that are important in human medicine should be used in animals only after careful review and justification, and minimize environmental exposure through proper handling and disposal. So where do the VFDs regulations start to come from? Well, there was a guidance 209 passed by the FDA in 2010, and that eliminated the use of medically important antibiotics for production uses, such as increased weight gain, improved feed efficiency. The 209 also said that they were going to increase veterinary oversight for the remaining therapeutic applications of medically important antibiotics. And this was affecting feed and water-based antibiotics, not injectable antibiotics. Also, back in 2013, there was a guidance 213 that was passed, and this has been over a 3-year transitional period. And so this was working with pharmaceutical companies to voluntarily discontinue claims for growth promoting uses on our antibiotics. It also eliminated the over-the-counter status of these types of medications and required veterinary oversight for on-farm therapeutic use by requiring a VFD for feed applications and prescriptions for water medications. So that was a 3-year transitional period that had been going on. over the past couple years, and January 1st, 2017 is when the veterinary feed directive was implemented. Basically, the feed medications require the VFD. It can only be issued by a veterinarian, and you cannot use any off-label use of these products, and we'll get into that further later on in the presentation. Water medications also require a veterinary prescription, only issued by a veterinarian, and you can use off-label use for water antibiotics, and that is under the direction of a veterinarian. Injectable medications were not affected by this, and some still remain for over-the-counter purchase, even if they were determined to be medically important. So what does medically important antibiotic mean? Well, that's an antibiotic that is used in humans as well. And so, to be honest, most of the antibiotics that we use in pigs are the same ones that we use in humans. So that affected a lot of the antibiotics that we're using in the swine industry. Here's just a list of the feed antibiotics, and you see a lot of these: neomycin, lincomycin, tylosin, chloracetylcycline. I mean, these are feed medications that are very commonly used in the swine industry and are medically important. Here's some water medications. Pretty much almost all of, well, not almost all these, a lot of these classes are all medically important, which, again, we use a lot of these in the swine industry. So it affected a vast majority of the ones that we use, with the exception of just a couple. So as far as feed grade medication goes, the four listed above: bacitracin, carbadox, ionophores, thiamulin. These ones do not require under the new regulations.
Should that be yet? Right? Isn't that something that's actually coming?
To be determined. So it's. As far as I know, there's no regulations for that now. Whether that's going to come in the future is a matter of the FDA. So I don't want to make any claims about that at this point now. Mm-hmm. So essentially, over-the-counter sales of any medically important antibiotics no longer possible. A valid VFD or prescription is required for distributors to send medication, so i.e. your feed mill, and for producers to use it. A veterinarian may only issue a VFD prescription in the context of a veterinary client-patient relationship. So we'll delve into more about what that is. So a VCPR is a legally defined relationship between the veterinarian and a client. So the federal guidelines have been set by the AVMA, but additional guidelines may differ by state. So I'm not very familiar with Connecticut or New Hampshire, whether they have more strict guidelines in terms of defining what that is. A lot of states default to the federal definition that's set by the AVMA, but you'd have to look at your specific state, or your veterinarian would know if there's specific guidelines that differ. So the states have the ability to kind of either usually make those more strict or more stringent. So the components of a VCPR. So I think there's about 5 components that define what a VCPR is. So the veterinarian has assumed responsibility for making the medical judgments regarding the health of these animals. And the need for veterinary medical treatment. The client, or the owner, the caretaker of the animals, has agreed to follow these instructions. So that's part 1. The veterinarian has sufficient knowledge of the animals to initiate at least a general, preliminary, or tentative diagnosis of the medical condition of the animal. The veterinarian is acquainted with the keeping and the care of the animal by virtue of an examination of the animal or medically appropriate and timely visits to the premise where the animal is kept. The veterinarian is available for consultation in the cases of adverse reactions to or failure of the regimen of therapy. The veterinarian maintains records on the animal examined in accordance with regulations established by the board. So, how do you get a VCPR? In general, what that means is your veterinarian's got to go out to the site. He's got to come out to your farm. So, for probably what a lot of the people do around here, I'm assuming is, your small sites, big multi-site systems where we might see out in Iowa or down in North Carolina or even in Pennsylvania. For multi-site systems, that generally means the veterinarian must visit a representative number of those sites within that system. But for small guys, it's just, generally visiting the site there. The veterinarian should also be working with you together to design and maintain protocols for vaccinations, feed medication protocols, treatment guidelines, husbandry, and management decisions. And the client should also be agreeing to follow those recommendations for treatment. It's important to remember that just having a VCPR is not a blank check for antibiotics, right? The veterinarian is still going to be the decision maker in terms of what you should be allowed to use on the farm, what you should be using on the farm. So it's an agreement to collaborate on an effort to develop specific and targeted control measures and to maintain health at your site. The veterinarian should always be working with you to first decrease the need for antibiotics, right? So what husbandry or management changes can we make so that we don't need to give these antibiotics? That should really be the first thing you're working on. Again, just kind of reinforcing the fact that the veterinarians are the ones that are in charge of making these decisions. So we're responsible for determining the diagnosis of the issues that you have at your farm and giving you the correct treatment regimen. So we can only prescribe these antibiotics to treat illness when pigs are sick, to control the spread of illness within a herd, or to prevent an illness at specific times of vulnerability. If we don't think it's responsible use, we're not going to prescribe it. So back to the veterinary feed directives. These are issued to allow for the inclusion of medically important antibiotics in the feed. A valid VFD is required for a feed mill to send out the medicated feed and for the producer to feed the medicated feed to animals. This is only used for on-label use of that feed medication. So we're going to kind of get into the components of what a VFD looks like. So it's going to have the name of the drug on there, your information, the address, your phone number, et cetera, et cetera. It's also going to have the information of the feed mill. It's also going to be determined for the species, the number of animals that are going to be treated within that time frame, any identifying features of those animals, their location, the dosage of the drug, any special instructions or cautionary statements. The date the VFD is issued, it's also going to be the expiration date. So VFDs are at most, you can use them for at most 6 months. Depending on the drug, there's some drugs, Palmitil for example, that you can only issue for 90 days. So at most, a VFD is good for 6 months. It is absolutely illegal to feed a VFD after a VFD has expired, even if it's already in your bins. So you must have a valid VFD in order to feed that medication. Again, back to the components of the VFD, it's also going to have the veterinarian's information on there and the veterinarian specifically who issued that and their license number. The drugs approved or index listed indications for use, feeding instructions or any cautionary statements, mixing directions, withdrawal times, always important. It's going to have the withdrawal times listed out there for you. So in terms of the VFD, so you can't put multiple drugs on one VFD. You need a separate VFD for each medication that you're using. If you're in a multi-site system, you can have multiple sites fed from the same mill on one VFD. Again, like I said, 186 months max duration on the VFD. And you must have the appropriate on-label need for the VFD medication. So this gets into on-label use and label claims. So there's a list of diseases or agents for a specific drug that was tested and proven effective against during the licensing trials with the FDA. So this includes the dose and duration as well. These disease indications and treatment directions are only the only officially accepted use for these drugs. So if you're getting into off-label use, you're using it then different than what's on the label. So that means you change the dose, you've changed the duration, you've changed the route of administration, you're changing what diseases you're using it for. So that would define an off-label use of a medication. Off-label use is illegal in all circumstances without any veterinary direction. Of any water or injectable medication. So that means, like I said earlier, you can use some off-label use for water, and injectable medication requires veterinary oversight and a veterinary prescription, but we can't do that at all for feed medication. So let's look at a label here. I know you guys probably can't read this over to the side, which is it's not that important. So this was a label that you have used for CTC, so chlorotetracycline in growing pigs. Extremely common medication to use in our growing pigs, right? So at one time, there was a label claim administered 10 to 50 grams per ton for increased rate, weight gain, and improved feed efficiency. Administer at 50 to 100 grams per ton for reduced incidence of cervical lymphadenitis, gel abscesses caused by group E strep susceptible to chlorotetracycline. That's gone, right? We can't use it anymore because that's for growth promoting claims. Gel abscesses, never seen one in my life, never heard about it. Maybe that was something I think a long time ago. I've talked to a lot of vets, never treated it before. So it's probably, again, one of those things that they were using it for when they were trying to get this drug approved, but that's just not something we really use or treating in pigs. Still on there, but I would say it's not practical. As far as breeding swine goes, 400 grams per ton to control leptospirosis. Again, something that probably rarely ever gets, we're probably rarely ever treating for, even though it is on the label claim. Probably the only one that we really are using is for the treatment of bacterial pneumonia caused by Pasteurella. You can potentially use it to treat E. coli or Salmonella, but I'll say there's a lot better drugs to be using. It's really not one that I would pick or go for. So probably the only label claim that we're really using is this one. This can be fed for not more than 14 days. So if you've ever done anything other than those things, then you're not being in accordance with the veterinary feed directive and the law at this point. I'll skip some of that. So again, if you were doing anything other than the label claim, a lot of farms used to be doing continuous chlorotetracyclines in lactation feed, or using Tyland in the grow finish phase at the growth promoting level. All that stuff is gone and has been gone since January 1st. So in terms of the feed mill responsibilities, feed mills, probably just about every feed mill come January 1st had notified the FDA that they wanted to distribute feed medications, so they had to go through an approval process for that. So it's important to know if your feed mill is licensed to do so, but probably all of them are, or most all of them are. Just in terms of their responsibility, they're supposed to be ensuring that there's a valid VFD in place prior to shipping any medicated feed. They have to maintain those records for 2 years. In terms of the producer, so your guys' responsibility, you need to be maintaining your VCPR. You need to be ensuring the presence of a valid VFD before ordering any medicated feed. You need to ensure a valid VFD prior to feeding the medicated feed. You need to not be feeding any VFD medicated feed after the expiration date. and you should be maintaining a record of your VFD for 2 years. We automatically, our office usually mails or faxes any records of VFDs that we're issuing. We've always put big stickers on there to say to keep in your file for 2 years. But just so, if the auditor comes around, it's just another thing that you have in your filing then, but you need to keep it on hand. So, in terms of our responsibilities for maintaining a VFD, so obviously be appropriately licensed. We're understanding the rules of the on-label medication claims. We're also maintaining that VCPR with our clients. We're issuing VFDs only when it's appropriate and correctly filling out the forms and contacting the feed mills. Also maintaining a VFD copy for our records and distributing out that to our clients. Just to change gears a little bit into the water medication. So again, prescription medication now to be issued by a veterinarian for treatment, control, and prevention of disease. You do need to have a valid VCPR. Our prescriptions, we retain those at our clinic. When prescription products are ordered, we keep a copy of those. We also put a label on all the products with all the prescription information on there. And we also keep an accurate record of the use of these, prescription medications. We keep a record of those. Also, people on the farm should be keeping a record of those for a year following their use. So, what's the goal on our end, on your end for implementing this process? Basically, we want to help our clients and the industry use antibiotics responsibly. We want to ensure that all the laws are followed, keep our clients and the feed mills and the vets and keep everybody out of trouble. We want to obviously keep the pigs healthy and keep farmers in business. So this is also, it's another good opportunity to be out on the farms, to be assessing pigs, overall health, identify disease challenges, review records, et cetera, et cetera. I mean, this is the good opportunity to work with your veterinarian as well as far as discussing vaccination and treatment protocols, management changes, husbandry changes, that sort of thing. That's it. I know that's a kind of not the most exciting topic in the world. It's important. It's the paper part of it. It's the regulation part of it. But it's important to have. I think the take home is just you got to be in you need to have a relationship with your vet. Your vet's got to be out to the farms in order to get any sort of VFDs or water medication. So in our office, that obviously a lot of the bigger sites we're out to on a pretty regular basis. Some of the smaller farms, kind of depends on the facility type, but generally that means every 6 months to every year visit, kind of like your checkup at your doctor, So, what questions do we have about that?
Well, what advice would you give us here?
Mm-hmm.
With no vets.
With no vets, yeah. So do you have any kind of mixed vets that will come out, or is it just hard to get somebody?
Not that knowledgeable in swine.
Yeah.
Yeah, they,
Mm-hmm.
if you pay $100 for them to show up,
Mm-hmm.
and they really don't help the animal because they don't have any idea of what species they're working on.
Mm-hmm.
It gets pretty frustrating.
Right, yeah. I would encourage, we work in situations like this with other veterinarians, so lots of times we get veterinarians that call us for kind of consultation, so you can always get in contact with us to have those discussions, because sometimes even a lot of these vets don't even have access to some of the medications that they need. So if your veterinarian gives us some prescription, sometimes we can even get the medication out to you as long as we have that prescription from the veterinarian. But yeah, I would say maybe getting them in contact with a resource like us is a good idea. Licensed mixed animal veterinarian should be able to issue a VFD, and if they're not sure what to do or how to handle that, again, getting them in touch with us is always a good starting block or a good resource, I guess I would say, at least to help guide them into the right direction. So.